Welcome back from the break, everyone. We hope you're able to interact with some of the exhibitors in the virtual trade show. In the last hour, we are joined live by Premier Doug Ford. Now we get to hear from Ontario's new Minister of Health. Welcome, Minister, and thank you for being with us today.
Hello, everyone. I'd like to start by thanking the Association of Municipalities of Ontario for their support and partnership throughout the COVID-19 outbreak. Together, we have made the health and safety of all Ontarians our #1 priority. As a result, all of Ontario is now in Stage 3, with our communities and constituents able to safely enjoy its many benefits, such as eating a great meal at their favorite patio or restaurant, being able to see more friends and family at a safe distance, or perhaps getting back to some long-neglected New Year's resolutions by visiting the local gym. Getting to this point has been no accident. In fact, it's only been possible with the help of partners like AMO and municipal leaders, as well as the diligence of Ontarians in following public health advice. Together, we have made significant progress in stopping the spread of COVID-19. So I do want to say thank you. But as everyone will agree, we cannot be complacent. One of the cornerstones of our response to the pandemic has been expanding COVID-19 testing. We have made great strides throughout the outbreak, starting with being the first province to begin our own COVID-19 testing. We established an integrated provincial lab network among public health, hospital, and community labs, which now can process over 33,000 tests in a single day. We also released Ontario's renewed testing approach. We ramped up our testing capacity to protect the most vulnerable in our communities and started proactively testing several priority groups, including enhanced testing of staff and residents in long-term care homes and other congregate care settings. In fact, anyone who is concerned that they have been exposed to COVID-19 or may be at risk for exposure, including essential workers, are able to get a test even if they don't have symptoms. We can't manage what we can't measure, and our expanded testing strategy is a key defense against COVID-19 as we gradually and safely reopen the province. As a result of these efforts, Ontario is now the clear leader in Canada in daily COVID-19 testing as we continue to invest in further expansion of our capacity, especially ahead of any potential second wave. Another key cornerstone of our response has been case and contact management. This is a process of working backwards to identify and monitor the people who have come into close contact with those who have tested positive for the virus. Recently, we announced enhanced case and contact management to quickly test, trace, and isolate cases of COVID-19 to stop the spread of the virus and prepare for any potential future waves. Our government is also moving forward with the long overdue work of replacing the outdated Integrated Public Health Information System, better known as IFIS, with a new custom-built system for COVID-19. This new system will finally do away with fax machines, yes, and result in faster, more effective case and contact management. To support case and contact management, Canada recently launched the new COVID Alert app, which lets users know if they may have been exposed to the virus. A made-in-Ontario innovation, COVID Alert uses Bluetooth technology to detect when users are near each other. If a user tests positive for COVID-19, they can choose to let other users know without sharing any personal information. Ontarians who receive the alert can then get tested and take action to help keep themselves, their families, and their friends from spreading COVID-19 throughout the community. The app does not collect personal information or health data and does not know or track the location, name, address, or contacts of any user. While these tools have been critical to our success thus far, each of us knows that we cannot be complacent. We can't take anything for granted. The best defense is and will remain the people of Ontario adhering to strong public health advice, staying home when ill, practicing physical distancing, wearing a face covering when doing so is a challenge or where required, washing our hands often and thoroughly, and keeping our social circles safe. Together, we must all continue to lead by example and promote these simple, everyday actions that have an enormous impact. As we look ahead to the fall, our government has worked alongside our top public health experts and frontline system partners to develop a plan for future waves of COVID-19. This plan has 6 main goals. 1, maintaining public health measures, our first line of defense. 2, delivering the most comprehensive flu campaign in Ontario's history. 3, quickly identifying and managing all COVID-19 outbreaks, including through the expanded testing and enhanced contact and case management I've already highlighted. 4, reducing the backlogs of surgeries and other procedures, as well as continuing to create more hospital capacity. 5, preparing for surges of COVID-19 cases by increasing community capacity, including more digital and virtual care. And number 6, recruiting, retaining, and training healthcare workers and other caregivers, including and especially personal support workers who are critical members of care teams, particularly in long-term care, as well as home and community care. Another way we are preparing is through the introduction of even more Ontario health teams. Last year, long before any of us had even heard of COVID-19, remember that? Our government began an ambitious project to significantly improve the care Ontarians receive and end hallway health care. Among many other initiatives, this included announcing the first 24 Ontario health teams. Over the past several months, Ontario health teams have demonstrated remarkable responsiveness to the COVID-19 outbreak. Ontario health teams have brought healthcare and community providers together to successfully address COVID-19 related issues in many ways, including expanding remote physician care through video. Partnerships with community providers and Ontario health team partners have been critical to keeping the number of visits to hospitals low and ensuring patients can access care in their homes and communities. This will continue to be essential in advance of further outbreaks. Where connections between home and community care were strong, these service providers were able to better support the regional system response. Care delivered at home can also assist in preventing infection and enabling patients to be supported by family members. As Ontario health teams continue to expand across the province, these collaborations and the lessons learned will also help better prepare the entire province for the flu season and potential further outbreaks of COVID-19. That is why I was so pleased recently to announce 5 new Ontario health teams across the province and invite an additional 17 teams to submit a full application to become an Ontario health team. If approved and at maturity, these 17 teams will join the existing teams to cover 80% of the province's population. Beyond our work on Ontario health teams, our government has also been making real progress in implementing Roadmap to Wellness, our plan to build Ontario's mental health and addiction services. This roadmap provides a clear path forward towards offering Ontarians easier access to higher quality services and supports in communities across the province. It's an important part of our commitment to invest nearly $4 billion in mental health over the next 10 years. In May, we invested $12 million in emergency funding to mental health agencies to hire and train more staff and purchase necessary equipment and technology. This funding is also supporting the creation and enhancement of virtual and online supports for mental health services, including internet-based cognitive behavioral therapy, supports for frontline healthcare workers, and virtual mental health support services. Through collaboration with sector partners, we have enabled more flexible staffing options for ambulance services to stabilize operations during the COVID-19 outbreak and future emergencies declared under the Emergency Management and Civil Protection Act. Now, as you are all well aware, in the 2019 budget, we announced our plans to modernize public health and emergency health services. And since that time, we have been working with you to address your concerns through renewed and expanded consultations. These consultations, led by Jim Pine, our advisor on public health and emergency health services, were put on hold in mid-March due to COVID-19. Once the pandemic is contained and risks are mitigated for the people of Ontario, we will consider how to complete the consultations and move forward with making the important changes we need to strengthen our public health and emergency health services. But we have continued to support our public health services and emergency health services throughout the outbreak. Ontario's action plan responding to COVID-19 provided $100 million in additional investments for the public health sector, including public health units, to support monitoring and testing, and funding to support enhanced contact tracing. We are also providing $77 million in additional funding to support paramedic services and dispatch centers. To support the public health units as they continue to respond to COVID-19 across the province, I'm pleased to announce we are providing further stability to municipalities by investing approximately $47 million in one-time mitigation funding for public health units for both 2020 and 2021 funding years. This funding will ensure that municipalities do not experience any increase as a result of the change to the 70% provincial and 30% municipal cost sharing that came into effect in January during this critical time. The funding letters will be sent out to you soon, and part of the funding package will include the reimbursement request for the COVID-19 extraordinary costs. I'm also pleased to announce that we have increased the funding to the Land Ambulance Services Grant by 5% in 2020-2021. This is in addition to the 4% increase last year. Of the many things that COVID-19 has highlighted, one thing is abundantly clear. A strong, resilient, and high-functioning public health system is critical to building healthy communities. Once again, our government appreciates and values our partnership with AMO and looks forward to continuing to work with you to protect the health and well-being of all Ontarians. Thank you.